Bonjour à tous, bienvenue à la conférence de presse d'aujourd'hui. Hello everyone, welcome to today's press conference. Je passe la parole au ministre LeBlanc.
Merci beaucoup, Corinne. Bonjour tout le monde. Good afternoon. I am joined today by my colleague Anita Anand and doctors Tam and Njoo, as well as Major General Fortin. As our government ramps up the delivery of vaccines to provinces this week, we know that more Canadians will be offered the opportunity to receive their vaccine, and we encourage everyone who's offered this opportunity to accept. Lorsque vous aurez reçu votre vaccin, nous vous demandons de continuer cependant à suivre les directives locales de santé publique, de continuer à porter un masque et de garder une distance sociale appropriée. I would now like to invite my colleague Anita Anand to say a few words. Anita.
Merci beaucoup, Dominic, and good afternoon, everyone. I'm going to speak to two issues today, vaccines and PPE and other supplies. In terms of vaccines, I have a brief update on the progress that we are making to ensure that vaccines are delivered to Canada at an ever-increasing pace. We now have 3 approved vaccines in Canada, Moderna, Pfizer, and AstraZeneca Covishield. Our strategy of diversification in our vaccine procurements is continuing to benefit us in terms of volume. Last week, Canada received 643,000 doses of the Moderna and Pfizer vaccines in what was our largest delivery of doses to date. This week, we are on track to see approximately 945,000 doses of vaccines arriving in Canada in total. This number includes the weekly shipment of Pfizer vaccines, which this week is 444,600 doses, as well as the first shipment of 500,000 AstraZeneca Covishield doses, which are now en route to Canada from the Serum Institute and scheduled to arrive in this country tomorrow. Thus, almost 1 million doses will be delivered into this country this week alone, and next week we are set to receive more than 900,000 doses of vaccines, being Pfizer and Moderna vaccines, coming into this country. Vous m'avez déjà entendu le dire, et je le répète maintenant. Le Canada est sur la bonne voie pour s'assurer que nous avons suffisamment de vaccins pour que tous ceux qui souhaitent en recevoir puissent le faire d'ici la fin septembre. En d'autres termes, assez pour tout le monde d'ici la fin de l'été. You've heard me say it before, and I will say it again now. Canada is seeing millions of vaccines coming into this country, and we remain on track to ensure that we have enough vaccines for everyone who wishes to receive one before the end of September. It has been almost a year since our lives were immeasurably altered, and we have faced many hurdles since that time. I will now provide a brief update on our procurements, including PPE and other supplies. At a time of intense global competition for N95 respirators, we have received more than 112 million of these masks so far, and we have in place 2 long-term contracts with domestic manufacturers. For example, Medicom has produced 6 million plus N95 masks to date. We have received more than 20 million liters of hand sanitizer, more than half of which was made in this country. 40.5 million rapid tests have been procured, with more than 22 million of these tests delivered directly to the provinces and territories. Nearly 190 cold and ultra cold freezers have been delivered as well. 7 million low dead volume syringes have already been received, and millions more are en route. These are the procurements that we have made, in addition to many others, for the interests of Canadians' health and safety. And we will continue to make these procurements while we battle this pandemic. To conclude, Canada is prepared and Canada remains on track. En cette période de concurrence mondiale sans précédent pour les vaccins, nous travaillons continuellement pour accélérer les livraisons. Nous avons vu des livraisons en décembre, des doses supplémentaires au cours de ce trimestre, des millions de doses supplémentaires ajoutées aux livraisons des deuxième et troisième trimestres aussi. During this time of unprecedented global competition for vaccines, we will continue to work to accelerate deliveries. We saw early deliveries in December, additional doses in this quarter, and millions of additional doses added to the second and third quarters. While there remains a good deal of work to do, we have a long-term plan in place. We remain focused on it, and we will continue to pursue it in the interests of all Canadians. Thank you. Merci. Miigwech.
Anita, thank you very much. I'll now turn to Doctors Tam and then Dr. Njoo.
Thank you. And bonjour à toutes et à tous. Today, there have been 870,033 cases of COVID-19 in Canada, including 22,017 deaths. Following a month-long decline in COVID-19 activity, daily cases counts have leveled off, and we're now seeing a moderate increase nationally. There are now 30,430 active cases across the country. Over the past week, an average of 2,933 new cases and 42 deaths were reported daily. During the same time period, 2,169 people with COVID-19 were being treated in our hospitals each day, including 568 in critical care. When case counts remain elevated or increase further, the concern is that we will soon see an impact on hospitalization, critical care, and mortality trends. At the same time, the number of cases involving more contagious variants of concern continues to increase. As of March 1st, a total of 1,257 B117 variants, 99 B1351 variants, and 3 P1 variants have been reported across Canada. Although the highest numbers have been reported in the more heavily impacted provinces, no province has been spared. Smaller provinces in the Atlantic region shows us that after many months of strong control, the situation can quickly get out of hand once more contagious variants are introduced. By the same measure, these provinces demonstrated that quick, strong public health action is the best way to regain control. On the really hopeful side of the vaccine versus variants leg of this marathon, we are gaining more ground every day. Last week, Health Canada authorized 2 additional safe and effective COVID-19 vaccines. We now have 4 different COVID-19 vaccines with unique advantages, but all contributing to the reduction of severe COVID-19 illness and death in Canada. To that end, yesterday, the National Advisory Committee on Immunization, or NACI, updated its guidance to include recommendations on the use of the newly authorized AstraZeneca COVID-19 vaccine formulations for optimal public health benefit. NACI is also assessing the time interval between the first and second doses of currently authorized COVID-19 vaccines to allow as many people as possible to be vaccinated while not compromising vaccine effectiveness. NACI is currently considering evidence from the latest scientific studies and is aiming to provide their recommendations this week. As the science of COVID-19 vaccination continues to evolve, expert advice is being adapted to maximize the benefits of all of the authorized vaccines. Canadians continue to support these efforts, not only by sacrifices we've made to buy time for research and innovation, but also through incredible levels of engagement, learning, and trust in the scientific process. This has been a difficult and long journey, but I know we remain steadfast in our resolve to see things through, aiming for the fewest interactions with the fewest number of people for the shortest time at the greatest distance possible is how we can all contribute our personal best to limit the spread of COVID-19 while vaccine programs continue to expand to protect all Canadians. Thank you.
Bonjour à toutes et à tous. À ce jour, il y a eu 870 033 cas de COVID-19 au Canada, dont 22 017 décès. Après un mois de diminution de la transmission, le nombre de cas quotidiens s'est stabilisé et il augmente maintenant de façon modérée à l'échelle nationale. Le nombre de cas actifs est maintenant à 30 430 au pays. Au cours de la dernière semaine, 2 933 nouveaux cas et 42 décès en moyenne ont été signalés chaque jour. Pendant la même période, 2 169 personnes atteintes de la COVID-19 étaient traitées tous les jours dans les hôpitaux canadiens, dont 568 étaient aux soins intensifs. Lorsque le nombre de cas demeure élevé ou augmente davantage, nous craignons que cela se répercute sur les hospitalisations, les admissions aux soins intensifs et les décès. Par ailleurs, le nombre de cas de variants préoccupants plus contagieux est toujours en hausse. Au 1er mars, 1257 cas de variant B117, 99 cas du variant B1351 et 3 cas du variant P1 ont été déclarés au Canada. Bien que les provinces les plus touchées aient enregistré les chiffres les plus élevés, aucune province n'a été épargnée. L'expérience des petites provinces de l'Atlantique nous montre que, même si la situation a été bien maîtrisée pendant de nombreux mois, elle peut vite devenir incontrôlable lorsque des variants plus contagieux apparaissent. Elle nous montre également que la meilleure façon de reprendre le contrôle consiste à prendre rapidement des mesures de santé publique énergiques. Le côté positif de cette longue lutte des vaccins par opposition aux variants, nous réalisons de grands progrès chaque jour. La semaine dernière, Santé Canada a approuvé 2 vaccins supplémentaires contre la COVID-19 qui sont sûrs et efficaces. Nous avons donc maintenant 4 vaccins à notre disposition pour combattre la COVID-19. Chacun dispose d'avantages uniques. Mais tout contribue à la réduction des cas graves de la maladie et des décès au Canada liés à la COVID-19. Hier, le Comité consultatif national de l'immunisation, ou CCNI, a actualisé ses lignes directrices afin d'y inclure ses recommandations sur l'utilisation du vaccin nouvellement homologué d'AstraZeneca contre la COVID-19 pour optimiser les avantages de la santé publique. Le CCNI examine également les intervalles entre la première et la seconde dose des vaccins contre la COVID-19 présentement autorisés afin de permettre le plus grand nombre d'immunisations sans pour autant compromettre l'efficacité des vaccins. Le CCNI envisage les données probantes issues des dernières études scientifiques et planifie formuler ses recommandations cette semaine. Tandis que la science qui encadre la vaccination contre la COVID-19 continue d'évoluer, nous adaptons les recommandations des experts afin d'optimiser les avantages des vaccins autorisés. Les Canadiens appuient toujours ces efforts, non seulement par les compromis qu'ils ont faits pour gagner du temps au nom de la recherche et de l'innovation, mais également par l'entremise d'engagement, d'apprentissage et de confiance inébranlable dans le processus scientifique. Le cheminement fut lent et difficile, mais nous savons que nous demeurons résolus dans notre démarche, ce qui nous permettra de la mener à bon fin. Nous devons chacun miser sur des interactions limitées avec le plus petit nombre de gens possible pendant le temps le plus court à la plus grande distance possible afin de contrer la propagation de la COVID-19, tandis que les campagnes d'immunisation visant à protéger tous les Canadiens prennent de l'ampleur. Merci.
Merci beaucoup, Dr. Njoo. Alors, on va se tourner maintenant au Major Général Fortin.
Merci, Monsieur le Ministre. Bonjour à tous. Good day, everyone. To date, we have distributed 2.9 million doses of vaccines across the country. This week, as previously mentioned, 444,000 doses of Pfizer-BioNTech are being distributed. So we anticipate receiving over 2 million doses spread over the 5 weeks of March with equal amounts each week. By the end of the first quarter, we'll have delivered 4 million doses of Pfizer-BioNTech. Pfizer-BioNTech has also confirmed shipments going into April. Shipments in the first 2 weeks of April is expected to be around 769,000 per week, and we're in the process of aligning those orders with provinces. As for Moderna, the manufacturer has confirmed and will now start shipping on a 2-week schedule. We expect to receive 466,000 doses for Moderna next week, and the second shipment will be 846,000 doses arriving during the week of March 22nd. So this will bring the total doses of Moderna to 2 million from December to March. April allocations detail are not yet available for Moderna, but we're working closely with Moderna to ensure a consistent and adequate supply. Last week, Government of Canada announced that the Oxford AstraZeneca vaccine has been authorized by Health Canada, as well as Serum Institute vaccine. 500,000 doses or early doses of the vaccine manufactured at the Serum Institute of India are expected to arrive in Canada as early as tomorrow. As for the balance of 1.5 million, 1 million are expected in April and 500,000 are expected in May. Following this good news, we launched discussions with provinces and territories on a per capita allocation of the allocation doses of the allocation of the available doses by the end of March. Based on their returns, the National Operations Center here will then move forward with the order process, and first deliveries are expected to take place in the coming days. So 300,000 doses will be expedited as quickly as possible, as these will need to be administered by April 2nd. Starting next month, we anticipate a steep increase in vaccine availability, and our efforts shift to vaccination ramp up. We're expecting to receive around 23 million doses of Pfizer-BioNTech and Moderna between April and June. AstraZeneca vaccines will be available with at least 1.5 million doses manufactured by Serum Institute arriving in mid-May, with more added to this package as we move forward. We continue to support the provinces and territories by providing them with as much predictability as possible on future shipments, and by bolstering their existing infrastructure and enabling equipment in order to optimize their immunization plans. We'll continue to lead the planning effort to ensure that the processes for delivering, storage, handling, and immunization clinics in the provinces and territories can keep pace with increasing shipment sizes of the authorized COVID-19 vaccines. So we remain committed to communicating updates or changes in the vaccine delivery plan so that provinces and territories are able to plan immunizations in line with vaccine availability. This is especially important as each provincial and territorial government is responsible for deciding how to distribute and allocate vaccines in their jurisdictions. Alors, à ce jour, nous avons distribué 2,9 millions de vaccins aux provinces et aux territoires. Cette semaine, tel que mentionné plus tôt, 444 000 doses du vaccin de Pfizer-BioNTech seront distribuées. Nous prévoyons donc plus de 2 millions de doses ce mois-ci à coût de 444 000 par semaine pour les 5 semaines du mois de mars. À la fin du trimestre, nous aurons donc atteint la cible de 4 millions de doses de Pfizer-BioNTech tel que prévu. Pfizer-BioNTech a également confirmé les livraisons pour le mois d'avril. Alors, pour les 2 premières semaines d'avril, les livraisons seront aux alentours de 769 000 doses par semaine. La distribution exacte est à être confirmée avec les provinces au cours des prochains jours. Quant à Moderna, le fabricant livrera ses vaccins sur un calendrier de 2 semaines. Nous nous attendons à recevoir 466 000 doses de Moderna la semaine prochaine. Et la deuxième expédition sera de 846 000 qui arriveront dans la semaine du 22 mars pour un total de 2 millions de doses, celles mentionnées précédemment, entre décembre et mars. Les détails de la répartition pour le mois d'avril ne sont pas encore disponibles, mais nous travaillons en étroite collaboration avec Moderna pour assurer un approvisionnement cohérent, adéquat, afin de bien planifier au niveau des provinces et des territoires. La semaine dernière, le gouvernement du Canada a annoncé que le vaccin Oxford AstraZeneca a été autorisé par Santé Canada. 500 000 doses initiales du vaccin fabriqué au Serum Institute of India arriveront au Canada dès demain. Pour le reste des 1,5 million de doses, c'est 1 million de doses qui sont attendues en avril et un demi-million en mai. Suite à cette bonne nouvelle, nous avons lancé des discussions avec les provinces et les territoires au sujet de la répartition de doses disponibles d'ici la fin mars. Sur la base de réponses des informations fournies par les provinces et les territoires, le Centre national des opérations des vaccins va ensuite poursuivre le processus de commande et les premières livraisons devraient avoir lieu au cours des prochains jours. 300 000 doses seront expédiées aux provinces et territoires le plus rapidement possible, car elles devront être administrées d'ici le 2 avril. À partir du mois prochain, nous prévoyons une forte augmentation de la disponibilité des vaccins auprès des fabricants de vaccins contre la COVID-19 autorisés. Nous attendons l'arrivée d'environ 23 millions de doses entre avril et juin de Pfizer-BioNTech. À ça s'ajoutent des doses supplémentaires du vaccin AstraZeneca nouvellement approuvé, soit 1,5 million de doses fabriquées par Serum qui arriveront d'ici la fin mai et davantage seront ajoutés à ce total. Nous continuons à soutenir les provinces et les territoires en leur offrant la plus grande prévisibilité possible sur les livraisons futures, en renforçant leur infrastructure et leur équipement de chaîne de froid afin d'optimiser leur plan de vaccination. Nous continuerons à diriger l'effort de planification pour que les processus de livraison, d'entreposage, de manutention et de vaccination des cliniques dans les provinces et territoires suivent l'expédition croissante des vaccins autorisés. Alors, en conclusion, nous restons déterminés à communiquer les mises à jour et les changements au plan de distribution aux provinces et territoires afin de bien planifier leur vaccination en fonction des disponibilités des vaccins. Ce flot d'informations constant est primordial puisque chaque gouvernement provincial et territorial est responsable de la distribution et de l'allocation de vaccins contre le COVID-19 à l'intérieur de leur juridiction. Je vous remercie.
Merci beaucoup, Général. Alors, Corinne, on est maintenant prêt aux questions.
Merci, thank you. Donc, nous allons passer à la période de questions. À titre de rappel, les règles sont une question et une question de suivi chacun. We will now take questions. As a reminder, you get one question and one follow-up question each. All questions today are on the phone. Donc, opérateur, première question.
Thank you. Merci. If you have a question, please press star 1 on your device's keypad. Si vous désirez poser une question, veuillez s'il vous plaît appuyer sur les touches étoile 1 de votre appareil. You may cancel your question at any time by pressing star 2. Vous pouvez à tout moment annuler votre question en appuyant sur les touches étoile 2. The first question is from, la première question est de Abigail Beeman de Global News. Please go ahead, à vous la parole.
Thanks for taking my question. I'm wondering first, what's your response to BC's decision to extend the second dose to 16 weeks? I noted that, Dr. Njoo, back in January, you said the core recommendation is that the system follows the manufacturer's layout. So I'm wondering if you still believe that's the case, or do you think other provinces should do what BC has done?
Well, thank you for the question. I'll maybe answer first because you made reference to my comments earlier, and it's certainly I know Dr. Tam has comments as well. Certainly, my comments back in January were based on the information we had at the time, which was basically the clinical trial data, which was submitted by the companies, in this case, I guess Pfizer, BioNTech, and Moderna, that led to the approval by Health Canada for the use in Canada. And since that was the only quote data we had at that time, certainly the recommendation was that that the vaccines should be used in accordance with the manufacturer's sort of approval with respect to the dosing interval. Now, what's happening is I think very encouraging, as I mentioned a few weeks ago, is that we have real world data, the actual experience of what's happening with the vaccinations. For example, in British Columbia and in Quebec, as they're vaccinating seniors in long-term care facilities and so on, and we're seeing quite a high level of protection. And also, it seems that the protection is obviously lasting for obviously even after the first dose. So, with that new information, obviously our experts, including our National Advisory Committee of Immunization, is looking very carefully at that and looking at exactly the point that was made earlier about what is the balance between vaccinating a larger number of Canadians and giving them a good level of protection with sort of looking at the interval while not compromising the effectiveness of the vaccine. And so I think that that's a live issue. The committee actually did give us a presentation to all the chief medical officers of health, including Dr. Tam and myself. And I think, as we just said in our statement, NACI will be coming forward with a statement, I think, shortly based on their deliberations. And I think I can't really speak to British Columbia, but certainly what they're doing, I think, has been taken into account all of the good information that's been discussed and presented to all of us. I'm not sure, Dr. Tam, would you add anything else?
Just to reinforce that, I just want to thank the National Advisory Committee on Immunization. They did give all the chief medical officers of health a good briefing on their findings and looking towards their publication this week, which should be very soon. And I think, as Dr. Njoo has said, Health Canada authorizes vaccines based on the fact that they are effective, efficacious, basically, in clinical trials and with additional data. They're safe and they're of high quality. What the National Advisory Committee on Immunization is doing in support of the provincial and territorial decisions on their vaccine rollout is to take into account not just the real data on some incredible data, actually, on just how effective these vaccines are in real life, even after one dose, that have endured a significant number of weeks. So over 2 months of data and beyond, showing that sustained level of effectiveness, but also taking into account the very fortunate situation we have in Canada, where now we have several different vaccines. And we can make decisions on how best to utilize all of them in concert. So that is a little bit different to how the regulator essentially approves each of the individual vaccines. When you have more than one of them, you're going to then give your best advice as to how you best utilize them based on the information. And lastly is that there will be a continuous monitoring of the vaccine effectiveness as we go along, not just globally, but British Columbia and Quebec, for instance, who have already stretched the interval of administration between these two doses, giving us the domestic real-life data from long-term care, from healthcare workers.
Thank you. I'm also looking for you to weigh in about the NACI recommendations not to use AstraZeneca in people 65 and older, specifically as France had reversed its similar decision, saying that there's more data out there showing the benefits for older people, and UK and Scotland have released similar real-world data showing its effectiveness in older people. So why would Canada recommend this approach?
Well, I think, again, the National Advisory Committee on Immunization looked at the data they have at hand, including some of that you've mentioned, and that is their recommendation at this time. Also recognizing of the fact that we actually have more than one vaccine, as I've just said, and I've already started immunizing, providing vaccines to some of the NACI recommended higher risk groups. So that is also taken into account as well. But fundamentally is that they will update. And I think just watch this space, as they see more and more of that real world data accumulating, that will be adjusted as well. So this is both a challenge, but also really exciting, because I think the real world data helping us to adjust our vaccine program is a really positive move. But I think don't read their recommendations as sort of static. They will update as needed, but this is what they've recommended at this point in time.
Merci. Thank you. Prochaine question. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Philippe Vincent Foissy de Radio-Canada. Please go ahead. À vous la parole.
Oui, bonjour. Deux petites questions sur le vaccin d'AstraZeneca. J'ai cru comprendre là, qu'on avait 300 000 doses du vaccin qui allaient expirer bientôt. Est-ce qu'on a eu un rabais pour ces doses-là? Puis, comment vous conseillez aux provinces de les utiliser alors qu'on a des avis contraires là, sur les 65 ans et plus? Vous leur dites quoi, d'utiliser ces vaccins-là pour les 65 ans et plus ou de les utiliser pour les autres, pour le reste de la population?
Je ne sais pas qui peut-être veut répondre aux questions de la quantité aussi, question sur le rabais, mais moi, je peux parler un peu de l'utilisation des vaccins d'AstraZeneca qui viennent de Serum Institute of India. On a tous les recommandations de notre Comité consultative nationale de l'immunisation. C'est sûr que, comme Dr. Tam a constaté, les recommandations pour les groupes d'âge, c'est basé sur les données probantes que le comité a analysées à date. Mais c'est sûr que les provinces et territoires, en considérant leur propre contexte et leur population à risque, ils peuvent toujours utiliser de la meilleure façon pour leur population. Je pense que c'est une question peut-être à poser aux autorités des provinces et territoires.
Peut-être, Anita, voulez-vous ajouter quelque chose aussi?
Bien sûr, je voudrais ajouter quelque chose aussi. C'est important de se souvenir que les 500 000 premières doses devraient arriver dans les prochains jours. Les deuxièmes envois comprendraient 1 million de doses et devraient arriver dans la deuxième moitié du mois d'avril. Et le troisième envoi, le 500 000 doses, devrait arriver à la mi-mai. Les provinces et territoires, et ça c'est la chose la plus importante pour moi, ont assuré au gouvernement fédéral qu'ils sont prêts à administrer un afflux de doses pour accélérer le rythme de la vaccination. Notre engagement est d'assurer que nous accélérons la livraison des doses pour que cela se produise. Donc, ça, c'est la chose très, très importante. Tout le monde ici au Canada, les provinces, les territoires ont assuré au gouvernement fédéral qu'ils étaient prêts pour administrer les vaccins. Donc, nous avons commandé les vaccins pour le pays, pour les provinces, pour les territoires aussi. Merci beaucoup.
Donc, ce que je comprends, c'est que vous êtes sûr qu'au cours du prochain mois...
I'm sorry.
Oui, donc la question de suivi.
Oui,
Est-ce que je peux poser ma question?
Oui, vas-y.
Oui, je vais ajouter quelque chose après votre question. Je vais ajouter quelque chose d'autre après ça.
Allez-y tout de suite. Allez-y tout de suite.
Oh, merci beaucoup. Ce n'est pas vrai de dire qu'il y avait une discount. Ce n'est pas le cas, pas du tout. Nous avons commandé et acheté des vaccins de Serum Institute avec les autres doses et ça, c'était la transaction avec Serum pour toutes les doses, pour tous les 2 millions de doses de Serum Institute.
Merci de votre réponse et de votre français aussi. Il faut le souligner. Merci beaucoup. Donc, ma question, au fond, c'est en ce moment, les Canadiens sont très confus. On regarde ce que Santé Canada a dit sur les 65 ans et plus. On regarde ce que le comité consultatif sur les vaccins a dit sur les 65 ans et plus. Ce n'est pas la même information. Les provinces vont y aller un peu au cas par cas, mais en même temps, il y a des craintes que cette confusion-là fasse peur aux gens, fasse peur aux 65 ans. Parce que dans les provinces, en ce moment, on vaccine les 70 ans et plus. On ne vaccine pas les 65 ans et moins. Donc, qu'est-ce que vous dites aux Canadiens pour les rassurer ou pour leur dire, regardez, ce vaccin-là, oui, pour les 65 ans et plus, il est efficace, ou non? Il y a comme beaucoup de confusion en ce moment. Et c'est l'occasion là, d'essayer de nous expliquer et de mettre fin à cette confusion-là.
Peut-être, moi, je pourrais débuter. Oh, moi, je vais débuter, puis je vais ensuite demander au docteur Njoo de vous donner l'aperçu scientifique et médical. Nous avons dit comme gouvernement national que nous avons acheté 7 vaccins possibles, et ça depuis déjà plusieurs mois. Nous sommes très contents, évidemment, qu'il y a 3 qui ont été à date approuvés par Santé Canada comme étant sécuritaires et efficaces. Évidemment, avec des lignes directrices, on s'attendait que ce soit partie de la discussion scientifique appropriée. Le plus grand nombre de vaccins que Santé Canada peut approuver donne plus d'outils aux provinces et aux territoires dans leur jugement suivant l'avis scientifique qu'ils vont avoir. Ça leur donne plus de choix et plus d'occasions d'immuniser leurs citoyens, d'offrir à leurs citoyens la possibilité de prendre un vaccin. Et nous allons continuer comme gouvernement national de procurer, d'acheter le plus grand nombre de vaccins qu'on peut et attendre évidemment l'approbation de Santé Canada et ensuite les acheminer vers les provinces et les territoires. Alors, nous voyons exactement qu'est-ce qui a été prévu depuis déjà plusieurs mois. Si on a ultimement une autre approbation, par exemple, de Johnson & Johnson dans les prochaines semaines, encore là, il y aura un outil accru, davantage que les provinces et les territoires pourront disposer afin d'immuniser leurs citoyens le plus vite possible. Alors, tout ceci a été prévu depuis déjà plusieurs mois, mais quand ce qui a trait à la question scientifique précise pour la vie des personnes qui ont 65 ans et plus, peut-être le Dr Njoo pourra répondre précisément à cet aspect-là.
OK, oui, merci, ministre LeBlanc. Moi, je peux dire que tous les vaccins approuvés au Canada sont sûrs et efficaces, ça sans doute. Et aussi, tous les vaccins aussi ont démontré une bonne efficacité pour réduire vraiment les maladies, les maladies graves, aussi les décès. Ça, c'est sûr. Donc, pour moi, il n'y a pas de confusion. La précision de notre comité consultatif national de l'immunisation pour les groupements d'âge, c'est selon les données probantes disponibles à date. Dr. Tam a déjà constaté. Et avec ça, c'est sûr, il n'y a pas assez des données probantes pour donner une recommandation pour recommander après l'âge de 65. Mais ce n'est pas la même chose que dire que le vaccin n'est pas efficace pour les personnes de tout âge. C'est seulement vraiment, comme dit, une précision scientifique selon des données probantes. Mais comme le ministre LeBlanc a constaté, on a toute une sélection, toute une choix des vaccins au Canada, et c'est sûr que les provinces et les territoires vont profiter d'utiliser toute la collection des vaccins disponibles pour immuniser les Canadiens. On a déjà commencé avec les 2 vaccins. Et maintenant, c'est sûr, avec l'approbation le vaccin d'AstraZeneca, aussi de Serum Institute of India, on peut aussi ajouter aussi avec des autres personnes. Mais Pour moi, c'est pas de problème, pas de confusion. Tous les vaccins sont sûrs et efficaces.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Ryan Tumulty de National Post. Please go ahead. À vous la parole.
Yeah, I wanted to ask about the 20 million doses of AstraZeneca that will be coming from the U.S. Beyond the Serum Institute's doses. We've heard a lot of talk from the Biden administration that they won't be allowing vaccines to leave the U.S., that they won't be ready to share until the American population is vaccinated. I'm wondering what assurances you have that those vaccines are going to be delivered to Canada, and if you have any sort of indication of the schedule for those deliveries.
Thank you, Ryan, for the question. We are receiving 20 million doses from a facility in the United States under our bilateral agreement with AstraZeneca. Those deliveries are going to be coming in Q2 and Q3. I have spoken with the corporation, AstraZeneca Canada, late last week to continue discussions relating to the delivery schedule for Q2 and Q3. And as soon as that delivery schedule is firm, we will provide it to the Canadian public and you, of course. We want to make sure that we have confirmations from the company before we provide that information, of course. And then on the question of assurances from the United States, we are in close touch, as I mentioned, with the corporation that has indicated it has not seen any problems with the export of doses to Canada. In addition, we have spoken with our embassy to ensure that those doses will be leaving the United States, and we have no reason to doubt that they will be coming into this country. But by the same token, we are ensuring that they will be delivered here across the border, just like we did with the N95 masks back in the spring. You will recall that initially we were told they would not be leaving the United States, but our diplomatic efforts and our work with the corporation allowed those masks to come into the country, and we will utilize whatever means necessary to ensure those vaccines come into this country. It is a priority for us, of course, given the approval of that vaccine last Friday. Thank you.
Ryan, your follow-up?
Yeah, just as a follow-up, I know you mentioned the assurances you've got from the company and the successful relationship with interaction, I guess, with the 3M mask in the spring. But I'm wondering if you have any specific assurances from the Biden administration that they won't block these doses. And if they do, I know AstraZeneca is manufactured all over the world in a variety of different plants. Is there a possibility of shifting Canada's delivery to one of those plants that included in the contract?
Okay, thank you, Ryan. Let me break down the AstraZeneca doses and where they are potentially coming from. The current time, as I mentioned, the 20 million AstraZeneca doses under bilateral arrangements would be coming from the United States. That's the first tranche, if you will, the first agreement. Secondly, the serum doses are coming from India. First batch arriving tomorrow, 500,000 doses in this country, which is very good news for Canadians. And the third tranche or area where we would see AstraZeneca doses coming from is via the COVAX facility out of South Korea at the current time. The discussions with AstraZeneca have been very positive, and AstraZeneca, in fact, has been very helpful in terms of suggesting alternatives if we run into any roadblocks. And those are solid relationships that we will continue to rely on. We have to understand that those relationships are extremely important given the intense pressure for vaccines in the global vaccine supply chains. And our goal at the outset, and it continues to be our goal, is to secure multiple sources and locations of production for this vaccine around the world. And it is on that rationale that we have this three-pronged approach to AstraZeneca doses coming into this country. Again, with our diversified approach, we have secured the earliest possible delivery of approved vaccines to Canada, with deliveries of the first 500,000 doses beginning tomorrow. Thank you.
Merci. Thank you. Prochaine question. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Marie-Kay Walsh de Globe and Mail. Please go ahead. À vous la parole.
Hi, thanks for taking my questions. As a follow, I think, to Ryan's questions, are you able to explain why it is that Canada only negotiated the deliveries of AstraZeneca vaccines in its contract after March? Why didn't it secure earlier?
Well, thank you, Marieka, for the question. I want to be clear that Canada was the first country to be able to reach a deal with AstraZeneca where there was no domestic manufacturing. And so AstraZeneca actually prioritized Canada, allowing it to enter into a bilateral transaction, despite the fact that there wasn't domestic manufacturing here. Once we secured that agreement with AstraZeneca for the delivery of 20 million doses here, they were very helpful in terms of isolating where they would be able to get that supply from. And the conversations prior to signing the deal saw us examining multiple places in the world of potential supply. And ultimately, AstraZeneca was able to assure us of supply from the United States. But I want to reiterate the point that Canada was very well placed and treated by AstraZeneca in terms of signing a bilateral agreement with us without domestic biomanufacturing, where it did not do that with any other country prior to that conclusion of the deal.
Okay. I'm not sure that really explains why we were only able to negotiate delivery in April, but I just wanted to go back to what you were saying in French about the Serum Institute. Can you explain in English why we're getting shots that are expiring so soon and what impact that had on price? Do we still pay full price or are we getting this at a discount?
Well, let me just say that the serum deal is for 2 million doses overall. 300,000 of those doses have the doses that need to be administered within 30 days. I want to be clear that all doses have expiry dates. The remainder of that tranche has to be administered within 60 days. And so it is important to recognize that we have high demand for vaccine in this country. We have provinces and territories that have repeatedly told the federal government that they want vaccines as soon as possible, and they're ready to administer vaccines as soon as possible. And on the basis of their desire for more vaccines, we executed a transaction for the delivery of 2 million vaccines within the next few months, the first 500,000 of which are arriving tomorrow. So in other words, we are responding to the desire for an increased number of vaccines. We are accelerating deliveries of vaccines from one quarter to the next. So you've already seen we are now at 6.5 million vaccines for Q1 alone. So beating our target of 6 million vaccines under Pfizer and Moderna now that we have another approved supplier. And in addition, we will continue to accelerate doses of vaccines. For example, since our initial agreements, we have accelerated the delivery of approximately 14 million doses of the 3 approved vaccines into the second quarter alone, the bulk of which are Pfizer and Moderna, 13 million doses of Pfizer and Moderna in the second quarter as opposed to the third quarter. So all of these transactions and negotiations are occurring against the backdrop of A, heightened demand for vaccine in Canada, B, the request of provinces and territories to have vaccines as soon as possible. That's our goal, and that's what we're responding to.
Merci. Thank you. We will take a final question. Nous allons prendre une dernière question. Opérateur, c'est à vous.
Thank you. Merci. The last question is from, la dernière question est de Catherine Lévesque de la Presse canadienne. Please go ahead, à vous la parole.
Oui, bonjour à vous tous. Je voulais rebondir un peu là-dessus, mais demander au major général Fortin en français là, pourquoi, en fait, si vous pouvez nous expliquer clairement pourquoi les doses d'AstraZeneca là, devraient être utilisées avant le mois d'avril et si vous pouvez juste confirmer là, que c'est parce qu'elles vont expirer, si oui, à quelle date et est-ce qu'il faut en comprendre que ce sera le cas pour toutes les livraisons d'AstraZeneca du Serum Institute et est-ce que c'est juste Serum Institute ou ce sera également le cas là, pour ceux de Corée du Sud et des États-Unis? Merci.
Bon, je pense que le ministre Anand a très bien expliqué que tous les vaccins ont une date d'expiration. Maintenant, dans le cas présent, cette semaine, 500 000 doses arrivent de Serum Institute. 300 000 ont une date d'expiration qui arrive, une date d'expiration du 2 avril. Bien entendu, ça demande une certaine administration rapide de la part des provinces et territoires quand ils vont recevoir le vaccin. D'une autre part, on ne veut pas non plus des vaccins qui restent trop longtemps dans des congélateurs, des frigidaires un peu partout. On veut que ce soit administré chez les Canadiens le plus rapidement possible et le plus efficacement possible. Alors, c'est un vaccin efficace. C'est un vaccin qui nécessairement exige une certaine rapidité d'exécution. Puis c'est une bonne chose parce qu'on veut que ce soit administré rapidement auprès des Canadiens qui devraient être vaccinés. Alors, pour ce qui est des autres vaccins d'AstraZeneca ou particulièrement Serum Institute, tel qui a été mentionné précédemment, ils ont eux aussi une date d'échéance, mais c'est plus loin dans le futur. Et puis, on n'anticipe pas de problème avec l'administration de ces vaccins.
Oui, aussi, et peut-être je peux ajouter quelque chose aussi. Ce n'est pas le moment de stocker des vaccins. Ils doivent être administrés le plus rapidement possible et les provinces, les territoires ont nous demandé de livrer les vaccins. Et ça, c'est notre but et ça, c'est notre projet et ça, c'est quelque chose que nous allons le faire pendant tous les mois et l'année prochaine. Merci beaucoup.
D'accord, merci beaucoup pour la clarification. I'm just going to turn to Dr. Tam for a question that was mentioned earlier, but I think you can maybe provide an answer on this. Since time is of the essence with the AstraZeneca vaccine, as your colleagues just said, are you suggesting or do you think that it could be a good solution that these AstraZeneca doses, given that there are contradicting facts or findings on who should be getting them, are you suggesting they should be administered to essential workers or racialized Canadians that are mostly affected by COVID-19? Could that be a good solution to get them quickly in people's arms?
I actually just want to reemphasize what Minister Anand said. It doesn't matter which vaccine you're going to have. One should be giving them out as fast as we get them. So that is a general principle, and that right now, I think all the vaccines are being given out really fast. So this is absolutely a area that all the provinces are discussing. We are discussing this at the Special Advisory Committee. In the end, it's up to the provinces to roll it out. But with the National Advisory Committee on Immunization's recommendations, you've essentially seen that one of the key ways to roll this vaccine out fast is in that younger population as a key option. And some of these groups are potentially prioritized a little bit later on in terms of the staging. Now there's an opportunity potentially for this a group of people who wouldn't have got the vaccine till a couple of months later to have the opportunity to get it. So, and if you looked at the NACI prioritizations, some of these groups do include the ones that you've listed, but it is up to the province and territories to implement how they're going to use the AstraZeneca vaccine.
Merci. Thank you. This puts an end to today's press conference. Ceci met fin à la conférence de presse d'aujourd'hui.